I want to personally thank you before even starting the interview. I've learned a lot from your lectures. You're one of the very, very interesting lecturers out there. I wish you could post more lectures. I literally never get enough. I mean, I know how your lectures are good when I listen to someone else because some people make science so difficult. You make it so simple, and that's
Oh, good.
amazing, actually.
I'm glad to hear that. Thank you.
First of all, I want you to introduce yourself to my audience. I love that I'm introducing you to the Arabic speaking audience and introducing them to your amazing knowledge and your very interesting way of teaching, actually.
Yes, well, that's very nice of you. Yep, I am a research scientist and a professor, and my science is what most people are interested in. I am the director of the metabolism and the diabetes research labs at my university, and my general area of research is to better understand the role of insulin in diseases. It's a necessary hormone. We need it, but we need it to work right in order to be healthy. And unfortunately, mostly because of the way people eat, insulin is working against us in a way.
Yeah, I like how you call yourself the insulin guy.
Yeah.
It's interesting. Yeah, let's dive into insulin. Actually, I think it's very interesting too, and it's kind of weird that it just came into light of its relevance to nutrition, just came into light like a few years ago. It's kind of weird, actually. Let's talk about what actually, in your opinion, has driven the obesity epidemic. What caused the insulin resistance to be very, very common? Almost everybody now has insulin resistance. And how can someone actually tell if they're insulin resistant, even from home without lab tests or anything?
Yeah. Yeah. So my views on human obesity are simple in a way, but a little more nuanced than most people think. So, obesity, without a doubt, will only happen if there's enough calories in the body to feed the fat cells. So that matters. The amount of food we're eating does matter when it comes to obesity, but we must combine that with elevated insulin. That if a person is eating more calories than they would normally, but if insulin is staying low, then they have a higher metabolic rate, and it's harder for the fat cells to grow because of it. So obesity is really a combination of these two variables, that a person is consuming a lot of calories, and two, that insulin is elevated. I think if you take away either of those, then obesity doesn't happen. You have to have both higher calorie and high insulin, because insulin is what tells the fat cells to pull in the energy and not to let it out. It pushes the fat cell to be in storage mode. And that leads into the next part of your question, which is to just explain insulin resistance. And insulin resistance really starts because fat cells get too big. So now this doesn't mean the person is obese. It might mean that for that individual, their fat cells are bigger than their fat cells should be. So people have what we could call a fat threshold. And this would depend on the person. Some people can get fatter and stay healthier than other people can, just because their threshold for fat is so much higher. And this is important to a degree, I think, in a large portion of the Arabic-speaking world, because we are seeing such an epidemic of diabetes, which is an insulin resistance problem. And you would look across the Arabic world and you wouldn't maybe see the high degree of obesity that we see in the Western world. It's not as prominent. When I have given talks in Dubai and Oman and Kuwait and another couple other places in the Middle East that I can't think of at the moment, but I'm struck by the fact that diabetes is such an incredibly big problem there, and yet they're not. These are populations that are not as obese as what I see here in the United States, but just some people start to suffer the metabolic consequences of that fat earlier than other people. So if people are getting fat, sometimes someone will they will reach their fat threshold and start to become insulin resistant and sick, and other people can continue to go until they reach their fat threshold. Now, how would someone be able to tell, someone listening to this and they're thinking, I'm a little overweight, I have a little more fat than I know I should, but how do I know if I'm insulin resistant? I would say if a person is overweight, if they have a larger belly, and if their blood pressure is starting to get high, that's probably as far as you need to go. That's very, very strong evidence that the person is insulin resistant. Of course, there are other variables that we could look at, but I think that's probably the simplest and most effective way of telling whether someone is insulin resistant. Are you overweight and do you have a high blood pressure? Now, if someone is able to measure their blood, then they could look at two different things. One, look at fasting insulin itself. And if fasting insulin is under around 45 picomoles, which I think it would be the units that would be used in your area of the world. If it's 45 picomoles or less, that's a very good sign. And then alternatively, you can look at blood lipids. If blood lipids are these two measurements of blood lipids, triglycerides and HDL cholesterol. If the ratio of those two, the triglycerides divided by HDL cholesterol, if it is less than 1.5, that's a very, very good sign that the person is insulin sensitive. If the triglyceride to HDL ratio is above 1.5, then that's a bad sign. That means they're probably insulin resistant.
How about LDL? Usually people freak out by the increase in LDL on keto. Okay, it made me lose a lot of weight and I never reached this weight before, but it's going to wreck up my life. I'm going to have a heart attack. LDL and cholesterol usually get high. Actually, this is the typical lab test I see with my keto patients. Fasting insulin is way better. Hemoglobin A1C is way better. HDL and triglycerides are way better, but cholesterol and LDL are usually higher than normal. Yeah. How do you explain that? Or how can we comfort people in this point?
Yeah. So I would say one thing, first of all, it's well known that when someone is experiencing active weight loss, so when they're actively losing weight, cholesterol is acutely elevated during that period of weight loss. That just happens, and it could be a reflection of the body's just moving a lot more fat around and burning a lot more fat. But because cholesterol is these LDL is a carrier for fats in the body, it shouldn't be surprising if a person sees cholesterol levels higher, especially during that phase of weight loss. Now, let's say that someone has stabilized their weight, that their weight has stopped, but they still have high LDL. I would say to that person, congratulations, having high LDL, because there are multiple studies, the Honolulu Heart Study, the Shanghai Aging Study, and another that I can't remember the name of, that shows that the people with the highest LDL actually have the lowest risk of dementia, of Alzheimer's disease, and they have the lowest risk of cancer, and they live longer, which totally challenges our fear of cholesterol. And so to say that again, just so everyone understands, there is significant evidence to suggest that having a high cholesterol level will help you live longer. And the people with the lowest cholesterol levels are much more likely to die younger, because cholesterol is an essential molecule, and it is essential to the immune system, where people with very low levels of cholesterol are about 15 times more likely to suffer and die from very lethal infections. The immune system is just too weak because LDL cholesterol is a vital, essential part of our immune systems. And we never talk about that. That never gets any attention. So if LDL is high, but the triglyceride to HDL ratio is good, and especially if triglycerides are low, then I would say that's a good sign. Don't worry about it. That LDL is your friend. It's protective. Worry much more about the triglycerides, because there's much more evidence to suggest that triglycerides are a problem in predicting heart disease rather than LDL.
Yeah, I think what most people call cholesterol disease or high cholesterol, they actually mean triglycerides. They don't actually mean total cholesterol. This is the real problem, and it's very common in the Arabic speaking world. I heard you in one of the interviews with Mike Matson on high intensity health. You were saying that in the Arabic speaking world, we're starting to get fatter and fatter. We're starting to get even higher rates of diabetes than the US, and
Yes.
it's actually very, very true. Especially lately, almost everybody has a lot of belly fat they're trying to lose. We have very bad habits of sedentary lifestyle, and we're afraid of animal protein more than anything else. Usually, most people in the Arabic world, we have this paradigm that you shouldn't be eating fat. Most people have most of their calories out of grains.
Yeah.
So I actually want to dive into the macronutrients because it's one of the lectures that I like hearing from you about the difference between carbs, fats, protein, and the relevance of each of them in our health and nutrition. What is the most essential macronutrient? What macronutrient should we focus on maybe decreasing or eliminating, and what macronutrients should we focus on prioritizing in our diets?
Yeah. Yeah. So my rules on nutrition are simple, but that doesn't mean they're easy because I realize, of course, that when it comes to asking someone to change what they're eating, that's not easy to do. It's very difficult to change dietary habits. But nevertheless, the ideas are simple, but maybe they're hard to actually implement. So for me, the first rule is control carbohydrates. I'm not saying don't eat them, but I am saying a person must focus more on fruits and vegetables and be very careful with grains and starchy, sugary foods. Of course, sugary foods are obviously a problem, but even grains are a potentially very big problem, especially for someone who is insulin resistant. They will look at bread and they will think, well, bread is a food that we've been eating for generations, for thousands of years, so bread is healthy. But people don't realize if they are insulin resistant, they may eat some bread, a few slices of bread, and their glucose and their insulin levels may be elevated for 3 or 4 hours after that. It takes a long time for that person to clear that glucose from the blood, and insulin has to be up very high and work very hard in order to clear that glucose from the blood. So control carbohydrates, focus more on fruits and vegetables, but eat them, don't drink them. Anyone listening to this, do not drink fruit juice. If God wanted us to drink fruits, then that's how we would pluck them from the tree. We should eat them. And that's so relevant because if someone wanted to drink a glass of orange juice, for orange juice, they would have to that one glass of orange juice would be the juice from maybe 4 or 5 oranges. And no one would ever sit down and eat 4 or 5 oranges. We would eat one orange and then we would be content because of all the fiber and just the process of eating it. It would be a little longer. We'd be chewing it more. But when you drink the juice, you can just drink it so quickly and you don't appreciate that all of that fructose, that carbohydrate from the juice is fructose, goes right to the liver and starts making the liver fat. Drinking too much fruit juice is going to be a very big driver of fatty liver disease. Anyway, my first point is control carbohydrates. And then the next two can come together. Prioritize protein and don't fear fat. And I do think I like to put them together because protein and fat come together naturally. And it's good for the human body. There's so much people want to focus on protein nowadays, but they will say they will just get the protein alone. But that's not natural. In nature, I can say this to your audience, I think, and be safe. God made all of the best proteins come with fat. Or if that offends people, I will say nature, Mother Nature made all the best proteins. But the best proteins for humans are eggs, dairy, and meat. They are the best proteins beyond any debate. plant proteins are an inferior source of protein for humans. It doesn't give us the right mix of amino acids, and we don't absorb it very well. And part of the reason we don't absorb plant proteins well is because these fake plant proteins don't come with fat. Fat helps fat.
Did you
Yeah,
call
well,
them
they fake. I did call them fake because trying to get protein from peas, like nowadays, pea protein is so popular. It's impossible to get protein from peas unless you have all of this modern technology that lets you take a pea and lets you take 1,000 peas, because peas are so deficient in protein that in order to get one serving of protein from a pea, you have to concentrate all the proteins from 1,000 peas in order to get that serving of protein. Unfortunately, when you do that, you are also concentrating things you don't want from those 1,000 peas, like, for example, anti-nutrients. All plant proteins have molecules in them that inhibit the intestine's ability to digest the protein. These are things like tannins or trypsin inhibitors. They will physically block our intestine's ability to digest. And there is evidence that in many of these plant proteins, they have high levels of heavy metals like lead and arsenic, because all plants are naturally pulling up minerals and metals from the soil. It's just that when we eat one little serving of peas on our plate, when we're eating them one at a time or whatever, we get so little of it that it is negligible. It's irrelevant. But when we have now suddenly concentrated 1,000 peas, now we're getting potentially unhealthy levels of things that we don't want. We wanted the protein, but when it comes to eating our protein from plants that are so deficient in protein, we have to concentrate it and process the proteins. Now we're getting some unintended molecules like anti-nutrients and heavy metals. In contrast, animal proteins are so rich in protein, and the animal itself is cleaning out some of these other things we don't want. They're cleaning out the metals on their own, that we don't have to worry about them when it comes to the animal-sourced proteins. So if a person is trying to get all their protein from plant sources, they will probably be protein deficient, and they will probably be getting other things they don't want to get.
What about lentils?
Yeah, so eating lentils and eating peas and eating plants, I have no problem with. But if a person is trying to get all their protein from lentils, I think it would be extremely difficult to do. They simply will not get what they need. I know this is a very delicate topic. I know people feel very strongly about animals and eating animals. But the fact of human physiology is that humans get their proteins from other animals. That is the best way. And I do realize I'm a very religious man myself, and I do think that where people see a moral dilemma where they think I shouldn't be eating animals, I do believe that humans are. It is our right in a way, but we should be grateful. We should acknowledge that we are eating something that was once alive and is now dead for us. But that is true across everything in nature. Something must die for something else to live. Even if it is a plant, when we are taking a plant, we're killing the plant to eat it, or we're taking its fruit, or whatever the fruit of this plant is, which contains its seeds, and we're not allowing that plant to reproduce. We're stopping its generations. We're killing it. And that's fine. I'm not saying that's an evil, bad thing, but I do think when someone is avoiding animal products because they don't want to kill an animal, they still have to acknowledge, well, I'm just killing a plant now. And other animals that die in the process of farming to grow soybeans or to grow peas. Something must die for something to live. That is an unavoidable fact of this world. And rather than feel guilty about that and try to never kill anything, which is impossible, we should simply be very grateful. We should truly, when we are about to eat that, whatever that food is, we should be grateful that this thing, whatever it was, this plant or this animal, gave its life so that we could be stronger and live longer because of it. I think it's a beautiful thing. It's a very beautiful idea to realize this, and it does have a responsibility on us as the thing that is living, as a result of something dying for us. But rather than feeling guilty, we should feel grateful.
I like how you say something has to die for something else to live. That's a very interesting concept. I think that's basic biology, third grade, the life cycle that we had in
Yes.
third grade, and it makes a lot of sense actually. I actually don't eat plant protein on a regular basis, but I told you that we in the Arabic world we have this like even guilt when we have a lot of meat because it's gonna cause gout. Some people actually say it causes cancer, and I wanna get into gout. And like other manifestations of insulin resistance that are not obviously insulin resistance. You can easily tell if your blood sugar is high that you have insulin resistance, but you cannot tell if you have gout, PCOS, hypertension, a lot of other manifestations that people do not actually acknowledge as insulin resistance.
Yes, yeah, well said. Yes, so there are common myths when it comes to eating meat, like gout, as you say, and the evidence just doesn't really support it. Where if a person is worried about gout, as you pointed out, all the more reason to worry about insulin resistance, because when the kidneys become insulin resistant, they force the kidneys to retain the uric acid. They don't allow the kidneys to excrete this molecule, this uric acid. And as the kidneys are forced to hold on to the uric acid, this uric acid starts accumulating in the blood, and then it starts accumulating at joints. And that's when the joint will start to hurt, and that is gout. So don't fear meat. Much more rational it is to fear the insulin resistance that is driving the gout. And like you said with infertility, the two most common forms of infertility in men and women are erectile dysfunction in men and polycystic ovary syndrome, or PCOS, in women. And both of those problems are problems of insulin resistance. In the case of the man, we need insulin to work, and we need our blood vessels to be insulin sensitive. And when insulin is coming to those blood vessels, it will tell the blood vessels to dilate. And that will, of course, increase blood flow. However, in the case of insulin resistance, that man's blood vessels have become insulin resistant, and now insulin's trying to tell the blood vessels to expand, but they stay constricted. And if you can't increase blood flow, well, then the man has erectile dysfunction. In contrast, in the woman who has PCOS, hers is a problem of there's too much insulin in the body during insulin resistance. And in order for a woman to ovulate, her ovaries need to transform a high amount of testosterone and convert this testosterone into the estrogen hormones, the estrogens. And insulin inhibits that conversion. So when insulin is high, it is telling the ovaries to stop that conversion. And now the ovaries are they wanted to convert testosterone into estrogens, but it can't anymore because insulin is stopping it. And so she doesn't have the high estrogen release, and so she cannot ovulate. And in contrast, her ovaries are now releasing high levels of testosterone that can make life harder for her, where she will start to have some characteristics that we typically associate with being a man, like going bald on her head, like being very, having more hair on her face or on her arms or legs, and having acne on her face. Those are all features of the high levels of testosterone. And again, that is a consequence of the high levels of insulin in her body. So numerous health problems that come from insulin resistance that people would never expect, like the ones we just said, gout and infertility, and we could go on and on, fatty liver disease, Alzheimer's disease, heart disease. To varying degrees, all of these problems arise from insulin resistance.
Yeah, I would like to dive into hypertension since it's literally everywhere. Everybody has hypertension now, and I see people relating it to stress I'm so young, but I'm so stressful. It's the kids. But it's actually, maybe stress is a factor, but it cannot be the only factor. So, how does actually insulin resistance cause hypertension?
Yeah. What a great topic that we can bring up. So yeah, it does drive hypertension to a degree. Um, like for example, I notice on myself if I have slept very poorly the night before, I will have a higher blood pressure the next day. But that will come and go, based on if I sleep fine, then my blood pressure is perfectly fine. But long term insulin resistance is going to be the main driver of hypertension, and that's because when a body is insulin resistant, insulin levels are higher, and when insulin is high, it forces the release of another hormone called aldosterone. And when aldosterone is high, aldosterone will make the kidneys keep lots of water. It won't allow the kidneys to push the water out from the body into the urine. And so the high insulin causing high aldosterone, and then aldosterone is directly preventing the kidneys from letting excess water in the body go. And so the body's holding on to more water, and much of that water is in our blood. It's our plasma, what's called the plasma in the blood. And of course, if blood volume is going up, if we have more water, more blood volume, then pressure goes up with it. Because our blood vessels, it's like we have a hose, and now we're opening the hose valve, and now there's much more water going through the hose, and the pressure is going up. So where you have more blood volume, we have more blood pressure as well. And that is the main connection between insulin resistance and hypertension. And what's sad, of course, is that a person would go to the doctor's office and be told they have hypertension, and then they would have to start taking a blood pressure medication, trying to solve this problem. It can never solve the problem. Medication can never solve the problem. Medication can only treat a symptom of the true problem. And so a person is taking hypertensive medications, but in the end, they will have to take it forever, because until they improve their insulin resistance, their blood pressure will never get better. The medication will not make the problem go away. It just covers the problem.
Okay, and since you covered medications, I was actually going to ask about the best interventions for insulin resistance. I mean, we've established that most people now are insulin resistant. So, what do you think is the best intervention? Is it low carb? Is it keto? Is it intermittent fasting? Is it all of the above? And actually, do you recommend medications to treat the cause? You just said that if it's a medication for hypertension, then it's just treating the symptom. What if it's a medication for insulin resistance, like metformin or something?
Yeah, in fact, I think you mentioned the only medication that I can kind of give a good grade to. Metformin is the most widely used insulin sensitizing drug, and it's most widely used because it is effective, and the side effects are generally pretty minimal. And so that to me is a medication that a person could be justified in using. However, as effective as metformin is, and it is the most effective medication, it is still at best only half as effective as even modest lifestyle changes. So when it comes to insulin resistance, the food we eat is the culprit or the cure. It's the food we eat that is causing the problem, and it's the food we eat that can cure the problem. And I mean it, like truly cure the insulin resistance or truly cure the type 2 diabetes, where the person's blood glucose is normal and they can keep it normal without taking any medications. That is curing the problem. And it must involve low carbohydrate, because if a person is eating starches and sugars all the time, then their insulin is elevated all the time, and they will always be insulin resistant and diabetic. And it's only when we cut the carbohydrates from the diet and focus on the less refined, like fruits and vegetables, and then with cutting the carbohydrates, glucose can start to come down because we aren't putting it in the body as much as we were before, and then insulin can come down as well. Now we're solving the problem. And we're not only solving the type 2 diabetes, but because we're bringing the insulin down, we're improving the infertility, we are improving the blood pressure, we are improving Alzheimer's risk. So we start to fix everything that comes with chronically elevated insulin. So I'm very strong in advocating a low carbohydrate diet for people who are insulin resistant or type 2 diabetic. I wouldn't say the whole world needs to be on a low carb diet. I don't say that. There are people who can thrive on any diet, low fat or low carb, and they can be perfectly fine. But I think more and more those people are rare. The average person is gaining weight and they are pre-diabetic. So these are people that need to be careful with carbohydrates and instead focus on protein and fat, which has very little effect on blood glucose and a much more modest effect on insulin levels.
Great. So even if someone is going to be prescribed metformin, they have to see it as as complementary to the lifestyle change, like dietary changes and stuff. What about a workout? Do you recommend any kind of workout as a treatment or even a prevention for insulin resistance? And do you recommend a resistance training or cardiovascular training or a mix of both?
Yeah. So in my mind, the best exercise to do to improve insulin sensitivity and fight off insulin resistance is the one you will do. Now that's a weak answer, I know, but the best exercise is the one that a person will just get out and do. So here it is, maybe I would say to the person, well, minute for minute, the best exercise is to go cross-country skiing. And for me, it's easy because I'm in Utah and it's winter. I'm in the mountains. But to say that to someone living in Dubai, where I gave a talk last year, or yeah, exactly. I would say you need to cross country ski, and they'll say, oh well, I'm just not going to do anything because Ben said that I should cross country ski, and that's impossible. Or I could say, you should do CrossFit because CrossFit is so effective. And a person, a middle-aged mom with 3 children, and she would say, I'm not going to go do CrossFit. That's crazy. I just won't do anything. So really, I mean what I say. The best exercise is the one that a person will do. Even if it is, let's say, like a busy mom or a woman in her 50s and her children are getting older, or they're in high school now. If she just goes walking with her friends, just go with the other moms and go walk for 30 minutes, that's good. That's wonderful. Now, having said all of that, I do believe that resistance training is the best strategy. Working the muscles of the body and pushing them, doing the exercise until the muscle starts to get a little uncomfortable, it starts to burn a little bit, and just to try to increase muscle mass. Muscle is the main consumer of glucose from our blood. So if we can push our muscle mass up, then when we have starches or sugars in the diet, we just make it so much easier for the muscles to pull that glucose in and help insulin and glucose both stay low. So I am a very big advocate of resistance exercise, but even still, anything a person will do, just get up and do something, and that will help. But we shouldn't look at exercise as being enough on its own, because it is not. If a person is exercising but they're still eating a very high starchy, high refined carbohydrate, high refined oils like soybean oil or vegetable oils, that won't help. The exercise won't help. Maybe they can walk better by exercising, but it won't help fight away the metabolic problems. Diet must be what is changed. And once you've changed your diet, and you're adding exercise to that, well, then now you're just helping. Diet will improve it this much, and then exercise will improve it that much.
Yeah, so we can think of it as a nutrition, a workout, and maybe after that you can think of medications or supplements as complementary to what mentioned above. Okay.
Yes.
What about glucose monitoring? It's starting to get kind of a trend recently. Everybody's monitoring their glucose, which is kind of a good trend, actually. But how often do you think people should do it? Should people, maybe I should talk about the insulin resistant. I'm not talking about diabetics because I think they are already doing it. But if someone is insulin resistant or is trying to start a low carb or a ketogenic or intermittent fasting approach to treat their insulin resistance, how often should they be monitoring their blood glucose after every meal, during fasting, and how relevant it is to their health?
Yeah, what a wonderful question. I would say for the average person, there is not a great need to monitor glucose too frequently. I would think the more effective strategy would actually maybe be to measure like circumference measurements. Like they have a measuring tape and they measure their neck and they measure their upper arm and their waist around their belly button or their hips, around their bum and hips. That would be the better thing to do. But if a person is worried about glucose, then sure, measure it. And I would say just every morning, measuring in the kind of later part of the morning, if fasted, not first thing in the morning, but later in the morning, if they can keep a fast going that long. Because right when we wake up, blood glucose levels can push up a little bit. That happens in everyone. And then it will start to come down a couple hours after we wake. So I would say if a person can, then measure their glucose around maybe 10 a.m. or so, fasted. That would be a good time to be checking. Also, not that I think everyone needs to adhere to a ketogenic diet, which is very low carbohydrate, but if a person is very afraid of diabetes, then there's no question that will be very effective to go very low carb. And in that sense, then measuring ketones becomes very helpful, because if your ketones are going up, that absolutely means you are burning more fat, because you make ketones from fat burning. When the body is burning a high amount of fat, it almost, because insulin is low, then you start to make ketones in that state from all that fat burning. Literally, the ketone is coming from the fat that we're burning as a result of our metabolism. So measuring ketones could also be helpful in that instance as well, to just to monitor how well a person is doing, especially if a person is adopting a low carbohydrate diet for the first time. Then measuring ketones for a week or two can help them know whether they're actually adhering to a low-carb diet. Because if the ketones are high, then you're doing it right. But if you don't detect any ketones, then you probably are eating more carbohydrates than a person thinks, and your insulin is staying higher than they might think it is.
Okay, so if someone is insulin resistant, they can measure their glucose and they can measure their ketones just to make sure they're on the right track, together with all the advice we just mentioned. You haven't mentioned intermittent fasting at all. I'm a big fan of intermittent fasting, and I would like to know your opinion about that. Do you recommend it? Do you recommend that anybody should be restricting their feeding window, or?
I do. I think fasting is incredibly effective, and the evidence is very clear that it is. You can take people with type 2 diabetes and just have them start fasting, and in any number of ways. They can fast 1-to-1, where they eat one day and then fast for 24 hours the next day, or they eat in a 4-hour eating window every day, or they eat 5 days and then fast for 2 days. There's any number of ways someone can do this. And it is very effective at reversing type 2 diabetes. It works very, very well. I am a very big advocate of a person getting off of the roller coaster of always elevating glucose and insulin. So the average person will wake up in the morning, and let's say they haven't eaten, hopefully for maybe 10 hours, hopefully. Insulin has come down overnight. That's a good thing. The body's becoming more insulin sensitive. When insulin is low, the body is burning more fat. It turns off glucose burning and turns on fat burning more when insulin is low. But unfortunately, most people wake up and the first thing they do is eat a starchy, sugary breakfast. They're eating cereal, they're drinking juice, they're eating bread, toast, or bagels or something. And immediately the insulin skyrockets up. And then it stays up for 3 hours or so. And then right when insulin's coming down, well, they start to get hungry and they think, well, I need to eat my mid-morning snack. And they bump it back up. And right when insulin's coming down throughout the rest of the day, they keep bumping the insulin up. So a person is spending every waking moment of their day in a state of elevated insulin, which is making the body ever more sick and fat and insulin resistant. So when a person can stop eating so often and start fasting, I believe that is incredibly effective at improving insulin sensitivity. And a person will be amazed at how good they feel. I know when I am fasting, this sounds silly, but I am more patient with my children. I'm a better husband. I'm a better father. I'm kinder. I'm more thoughtful. And then in contrast, when I eat too much and I'm full and I'm uncomfortable, then I get impatient and I'm snippy. I'm not as good of a person. I'm not as patient. And I believe that there are benefits to fasting that go well beyond just improving metabolic health, but also including improving mental and emotional health as well. So to be clear, I'm a very big advocate of fasting, and I think a person can do it any number of ways. As I mentioned a moment ago, there are lots of ways to intermittent fast. I would simply add one note of caution. The most important part of a fast is how you end it. So what the food is that a person eats at the end of their fast, that is the most important part of a fast. Because I have seen too many people who will fast, they will eat one meal a day. They will fast all day and then just eat only dinner. But they eat an incredible amount of food. They get so hungry that they end up eating all kinds of junk food. And then they stuff themselves and they feel sick. And now they sleep very poorly. They regret it. They feel bad about it. They hate themselves for doing it. And then they tell themselves that night as they're going to bed, tomorrow I'm going to be better and I'm not going to do it tomorrow. And the exact same thing happens. So I do worry sometimes that fasting can lead to a sort of strange eating pattern, almost like an eating disorder in itself. So when someone is going to fast, I would say make sure you have a very good plan for how you break your fast. Whatever that food is that you're going to eat, make sure you have planned it well. Make sure that you go slow and you don't eat too much too quickly. And tell a family member to help you. But just a person needs to make sure they don't overeat and they don't eat a bunch of junk food. So again, how a person ends the fast is the most important part of the fast.
Yeah, I'm sure you're familiar with Ramadan fast. We fast
Oh,
for a
yes.
whole month every year, and we're like experts in like wrecking all what we have done in fasting hours by eating like everything you can imagine. Ramadan is like, if you wanna come to Egypt one day, you should come in Ramadan, because it's like
Oh, I would love to.
the month of desserts. We eat a lot of desserts. We eat a lot of junk
Yeah.
food and a lot of carbs. And actually, we fast over 16 hours. Every person, every Muslim fasts over 16 hours in Ramadan, and we end up gaining weight. Some people gain over 10 kilograms in Ramadan, which is
Oh my
amazing. How can you
goodness.
gain weight? I swear to God, how can you gain weight fasting like 16 hours?
That
We
is a
make like,
perfect example. Yep.
yeah,
Because
yeah,
it
that's why
turns into
actually.
a feast of junk food.
Exactly, we make it a feast. Exactly, that's literally what we do. So, in closing, I want to like sum up if there is an advice for every person to maybe two kind of people who are scared of getting insulin resistance because it's becoming very common, and maybe they have a family history of diabetes, and people who already have insulin resistance and try to heal or become healthier. What is like the advice to these kind of people?
Yeah, yeah. But there's so much advice I would give, and we've given lots of it throughout our conversation now. I would say if a person did one single thing, I would say change breakfast tomorrow. Tomorrow morning, change what you eat. Either fast through breakfast and just drink coffee and tea, or eat a breakfast that is protein and fat based, not starches and sugars, not carbohydrate based. When insulin has come down overnight, let it stay down as long as you can, at least till lunch. And then eat a good big lunch and then have a smaller dinner. I think there is danger in having dinner be too big, where the evidence suggests that the actual best time to fast is to fast through dinner and eat breakfast and lunch, but that's hard to do. I don't do that, even though I know it's better, because dinner time is my family time. I'm with my wife, I'm with my children, I'm at the table, we're eating, we're talking, I'm going to eat dinner. So I think it's difficult to fast through dinner, and I wouldn't say do it. I would say, but eat a bigger lunch so that your dinner can be more modest. And then once you've eaten dinner, stop. Do not continue to snack all evening. You eat dinner and you are done. So That's my advice. It's longer than I expected, but change breakfast tomorrow and let your insulin levels stay lower as long as you can into the day.
Yeah, this advice is literally for anyone. So no one is good enough to not do this, because it will improve health of everybody. It helps with mental clarity. I'm actually
Yep.
like you. I feel more focused when I'm not eating breakfast than when I have breakfast.
Mm-hmm.
So I'm very happy that we had this conversation. This is going to be Arabic translated and will be posted on my
Wonderful.
channel as soon as possible. If you would like, I can send you a link of it on a drive. If you want to
Please.
share it on anywhere. Do you
Yep.
have like Instagram? I'm following
Yeah,
you on No
yeah.
Carb Down Under.
Yeah,
I
so
don't know
people
your
can find
social
me.
media.
No, I'm fairly active on Instagram. That's actually the only one I'm really active on anymore. I
Cool.
used to be more active on Twitter, and Twitter's just getting kind of ugly for me. So I'm more on Instagram, and people can find me there at Ben Bikman PhD. And also, I'm so happy. My book, so far it's still in English only. Is Why We Get Sick. It's
Yeah.
all about insulin resistance, but I think by the end of this year there will be an Arabic translation
Cool.
available. Yeah, I'm so happy about that. I have loved my traveling and my talking in that area of the world. I have loved it, including I was in Egypt many years ago and
Really?
all around
Cool.
the area, and I've loved it. So the idea of me being able to provide something helpful to people that I just adore, it means a lot to me. So I'm very excited that there will be an Arabic translation, hopefully before the end of 2021.
Yeah, that is great news. Actually, that is great news. I'm actually very happy that I'm introducing you to the Arabic speaking audience,
Me too.
because I really like your way of teaching. I can actually link your. I have a digital copy of your book. I can link the Amazon link to your book. A lot of Arabic speaking people can speak
You're
English well,
right. Yep.
so we can purchase your book now, and we can purchase it again when it's Arabic translated.
Yeah.
So I would
Thank you
love to
so
see that.
much.
Thank you.
Thank you,
Thank you
Juan.
very much. I will follow you now on Instagram, and I will just email you when the translation is done and it's uploaded on my channel. And I'm very happy I talked to you today. I just want, if there is any chance that you can record more of your lectures, that would be amazing. I mean, the lectures in the university, if you can find someone to videotape them, they're of extreme importance, and they're very interesting actually.
Well,
Thank you
I
very much.
appreciate that. That's very kind of you. Thanks again. This was fun.
Thank
Thank
you,
you.
Dr. Ben.